Hey, Dental Fam, it's your girl Leela. Who else? And welcome back to
The DA Study Spot, yeah.
I am back with another DANB breakdown. This one is General Chairside, aka GC. If you're studying for the CDA exam, this is where you get to show you can handle the hands-on side of dentistry, from setting up the op to working right alongside the doctor in procedures. Stick around because I got a mini pop quiz at the end to test your knowledge and see if you're ready to kill this exam.
Hold your horses.
Make sure you hit that like, subscribe, and notification bell so you are alerted when I upload new study sessions. First up, patient prep and communication. All right, so the first thing you want to do when a patient come into the office is greet them warm, confirm their treatment plan, and always update their medical history, even if you just saw them last week. Trust and believe you will be tested on this. If it's a current patient, it'll sound like, "Hi, Mr. Teeth, welcome back. I see we have you down for two fillings on your lower right side today. Is that correct?" "That is correct, Leela." "Awesome. Has there been any change in your medical history since we last seen you?" If no, continue as planned. If yes, you want to make note in the chart and inform the doctor. If it's a new patient, the interaction will be slightly different and it'll sound like, "Hi, Mr. Teeth. My name is Leela. So nice to meet you. Tell me a little bit about what's going on. Why are you here today?" "Well, I've been having some upper right tooth pain." "I'm so sorry to hear that. How long has that been happening?" About 2 days, and I took two Tylenol for it." "Okay. Do you have any medical history that we should be aware of?" You want to make sure you ask the patient about any allergies or meds that they are taking. Be sure to make note if the patient has any history of high blood pressure, knee replacement, hip replacement, heart issues. A lot of the times, these patients need to be premedicated before their procedure or need clearance from their primary care physician before the procedure. Communication is important in any relationship. So when we are speaking to patients, we want to be very clear and simple on what we say to them and how we explain procedures. We want the patient to understand what we're doing and feel comfortable. So we don't want to use any dental lingo that they do not understand. And remember, no treatment without informed consent. That's law. Next up, instrument transfer and four-handed dentistry. The whole goal here is efficiency, ergonomics, and safety. If your dentist is right-handed, chances are they'll be sitting around the 11 or 12 o'clock position, and you will be sitting between the 2 o'clock and 4 o'clock position. Know your grasp styles. There's three of them. There's the pen, modified pen, palm, thumb, and always pass instruments in the transfer zone without crossing over the patient's face. Somebody drop in the comments where the transfer zone is. For sharp instruments, which most of them are, you want to pass with the point facing away from the dentist's hand, which should be facing you. I linked two videos in the description box. One is the grasp styles, and the other one is the instrument transfer, so you can check those out. Next is dental materials and procedures. Now, General Chairside will test you on your materials as well. They're going to talk about amalgam, composite, impression materials, cements. You need to know their uses, mixing times, and storage. For example, alginate impression. Normal set is around 2 to 4 minutes, and the clock starts when you mix, not when you put it in the patient's mouth. Now, chairside, you assist with pretty much all the procedures: fillings, crowns, extractions. So you need to be one step ahead of the doctor. When you learn the procedure step by step, you'll be able to handle materials quick and keep the doctor moving. Next up, and a favorite, is charting and dental terminology. You will need to learn the different numbering systems. We have the universal, Palmer, and FDI. You need to know your surfaces. M for mesial, O for occlusal, D for distal, and so on. Check out my comprehensive tooth numbering diagram in the description box. Shows both primary and permanent teeth and surfaces and arches as well. Not only do you get the full comprehensive diagram, but you're also going to get a blank diagram that you can fill in on your own for practice. Only $0 for a limited time. Make sure you grab it. When you see MOD, that means it's a three-surface restoration. So mesial, occlusal, distal. Can anyone tell me what F stands for? Drop it in the comments. And also, you want to get familiar with chart symbols like decay, fillings, crowns, so you can mark the chart correctly. And last but not least, infection control in chairside settings. Even though infection control has its own section, it still shows up in general chairside. And I do have another video on infection control, so you want to check that out if you haven't gone through infection control as yet. Now, infection control in general chairside is just maintaining aseptic technique, which is making sure that you keep your treatment field clean and dry. Treatment field is the area of the mouth that the doctor is working in. So you want to make sure that you're using your HVE properly. That's your high volume evacuator. It's to control the aerosols and water spray. And then just staying ready to swap out instruments without breaking the sterile flow. And that's whether you're swapping out cotton rolls, dry triangles, or bite blocks. All right, so we've made it to the end, and it's time for the pop quiz. Question number 1. Where should the DA sit in four-handed dentistry for a right-handed dentist? Question number 2. What does MOD stand for? Question number 3. True or false? Medical history should be updated only when there's a change. If you said 2 to 4 o'clock position, mesial, occlusal, distal, and false, it's updated every appointment, then you got it right. Just like I know you would because you don't pay attention. If you find this video helpful, hit that thumbs up and share. And if you're preparing for the DANB exam, check out my comprehensive study guide that's linked in the description box. It contains all the key points you need to know to pass the exam on the first try. Next video, we're going to talk tooth numbering and surfaces. See you then. Bye.
The DA Study Spot, yeah.